Do you ever feel like you're sitting on a cactus every time you try to sit down? Or maybe you just finished using the bathroom and noticed bright red blood on the toilet paper? If that's you, you're not alone. So let's talk about something uncomfortable but a real problem: hemorrhoids. I am Dr. Emmanuel Aguh, a board-certified family medicine doctor, also called the WhizDoc, and this right here is a conversation that most people are too embarrassed to have, and you just don't want to have this conversation with your doctor. But I'll say it now: you do not have to suffer in silence. More importantly, I'm going to show you how to get rid of hemorrhoids. You'd be surprised how many patients often whisper this to me after the visit is over. Hey doc, is it normal for it to hurt down there? And you wonder, is it the front or the back? And they let you know that it's the back. Or they could say, there's this lump, it's been there for a while, but I was too embarrassed to bring it up. Look, if it hurts to sit, if wiping after a bowel movement is painful, if you've seen blood or you felt a bulge back there, this video is for you. We're going to walk you through the why, the how, and the exact steps to fix hemorrhoids, which could be done at home using over-the-counter medications and, if needed, with treatment from your doctor. You're going to walk away from this video knowing how to get rid of hemorrhoids and also to keep them away. So let's start with the basics. What are hemorrhoids? Hemorrhoids are also referred to as piles by some people, and these are just swollen veins inside of your rectum or around your anus. That's it. That's simple. There are two main types. You have the internal and external hemorrhoids. The internal ones are located inside of the rectum. You typically cannot see them, and they're usually painless, but sometimes can cause bleeding with bowel movements, or you can see a bulge. The external ones, on the other hand, these ones are under the skin around the anus. They're more external. These ones hurt, they itch, and they swell, and sometimes they can actually clot and form a painful hard lump. We call this the thrombosed hemorrhoid, and these are a lot more common than people think, especially in people over 50. But note that young folks also get them. It's not just about age, it's about the pressure down there, and we will talk about that. There's also good news. These hemorrhoids are rarely dangerous. However, they can seriously mess with your comfort and your quality of life. So what causes hemorrhoids? These happen when there's too much pressure in the veins of your lower rectum. That could be straining on the toilet, especially if you're really constipated. Maybe you sat too long, especially on the toilet, scrolling through your phone, through social media, reading messages, answering your emails. Pregnancy and childbirth can also cause hemorrhoids. If you're someone that lifts really heavy with poor form, that can increase your risk of hemorrhoids through the increased pressure down there. Also, eating low fiber diets, being obese, being inactive, having chronic diarrhea, and even just aging and gravity. With age, the tissues that support the veins in the rectum and anus, they get weak and they stretch, which increases the risk of hemorrhoids. Some of my postpartum patients come in with hemorrhoids after delivery. Pretty common, and many of the gym bros that I see, deadlifts and no fiber in their diet, they end up here with pain from hemorrhoids. So how do you treat hemorrhoids at home? We can start with the basics, the home remedies. If this is your first flare-up, here's what I'll tell you to do as your doctor. First step is warm sitz baths. You could soak for 15 minutes in warm, not hot water, about 2 to 3 times a day, in a tub. You can add Epsom salt or baking soda if you like. This can help soothe and shrink the hemorrhoid. Second thing to do is to add fiber and fluids to your diet. Aim for about 25 to 30 grams of fiber per day. You can get this from fruits, veggies, oats, legumes like beans, and also try to drink water. Fiber needs water to work, and this can lead to less straining, which leads to less inflammation. The next step is to ditch that dry toilet paper. So if you have hemorrhoids, avoid the dry toilet paper. Use unscented wipes or witch hazel pads. Make sure you pat, don't rub. And the pro tip is the witch hazel can actually cool and shrink the area. The fourth thing is, ice packs or cold compresses. These can help with swelling, especially painful external hemorrhoids. What you can do is wrap ice in a cloth and apply to the area for about 5 to 10 minutes. You could also use petroleum jelly. Just apply a thin layer before you go. Get a bowel movement, as this can help reduce the friction between your stool and the hemorrhoid. So if you follow these steps, many hemorrhoids start to improve in a few days and symptoms fade within 1 to 2 weeks. Some additional tips could include using like a step stool to raise your feet when you're having a bowel movement. It helps with the passage of stool. Wearing loose fitting clothes and opting for breathable underwear can actually also help with the friction or your clothes rubbing against the hemorrhoids. And like I said, most mild hemorrhoids get better within 7 to 10 days with the steps I just mentioned. Let's say you've tried the home stuff and it's not enough. relief. There are some over-the-counter medications that you can explore or use. One of them is hydrocortisone cream. This tends to reduce itching and inflammation. If you decide to use this, make sure it's short-term for no more than 7 days. There's also the lidocaine cream, which tends to numb the pain, numb the area, and that can give you instant relief. Another option is suppositories. Not for swallowing, but you put it up your anus. They're pretty good for internal hemorrhoids. And I mentioned earlier witch hazel pads. This is like a natural astringent. It will cause the hemorrhoids to shrink. And also stool softeners, especially if you are constipated. This can keep things moving smoothly and also help. If you are in a lot of pain, you can take pain relievers by mouth like Tylenol, Aleve, ibuprofen. This can help relieve the pain. Now, here's one combo I like. After the sitz bath, you gently pat the area dry, then apply hydrocortisone, after which you can use a witch hazel pad. This actually works wonders. So let's say if nothing's helping, you've tried the home remedies, you've used over-the-counter medication and it's not working, it's been more than 2 weeks, no improvement, or you notice that you're having severe bleeding or a lump that wouldn't go away, and you're just in extreme pain, you're really uncomfortable, it's time to talk to your doctor. Also a disclaimer, never disregard bleeding from the rectum. Let your doctor know immediately, since it could be a sign of cancer and you really do not want to miss that. So imagine you've tried all those measures and nothing worked. There are some in-office procedures that are minimally invasive, one of which is rubber band ligation. So for the internal hemorrhoids, we place a tiny band that cuts off blood flow, and the hemorrhoid in question will shrivel and fall off. Typically it's painless, can be done in the office, it's non-surgical. Another option is infrared or electrocoagulation. So we use like lasers, infrared light or heat to scar and shrink the tissue. Another one is called sclerotherapy. So in this situation, we inject a chemical solution which can help collapse the vein and shrink it, and this is really quick. And finally, this one is surgical, right? It's called surgical hemorrhoidectomy, and only a small percentage of people with hemorrhoids will require surgery to remove them. We typically reserve these for large, severe, or persistent hemorrhoids. Recovery is typically longer, but the results are permanent, and you might require a referral to a surgeon to get that done. Something I forgot to mention is if you have a painful clot in an external hemorrhoid, which we call a thrombosed hemorrhoid, we can actually remove the clot right in the office. We call that a thrombectomy, and the relief in that situation is pretty much instant. So now we've talked about treatment. How do you prevent these hemorrhoids from coming back? It just involves implementing some lifestyle changes like eating fiber daily, staying hydrated, exercising for at least 30 minutes a day. Try not to sit on the toilet, or don't sit for too long, especially on the toilet. And if you have to go to the bathroom, make sure you only go when you need to go. If you go to the gym, lift properly with good form. Do not ego lift, and avoid heavy straining when you're lifting weights, and also keep back there clean and dry. I'm guessing you noticed that if you follow these habits, not only do you reduce flare-ups, but you can also improve your gut health, your heart health, and your overall energy levels, and that's a win-win. I had a patient, John. He was a truck driver. He was in so much pain from hemorrhoids, he couldn't sit and he couldn't work because he had to sit in his truck for long hours. We got him on fiber and fluids, did a rubber band ligation at bedside, and within 2 weeks he was back on the road pain-free. So in conclusion, hemorrhoids are annoying, yes, but there are options available, real options that you can implement. You do not have to sit in silence, literally or figuratively. Please talk to your doctor, try these remedies, and share it to someone who's been too embarrassed to get help. And hey, if you found this helpful, tap the like button and hit subscribe. And also please drop a comment below. What's one thing in this video that surprised you, or something that you've tried before that helped with your symptoms. I am Dr. Emmanuel, the WhizDoc, and until next time, take care of your body and it will take care of you.